Hi, and welcome to this presentation sponsored by the NHA Research and Education Foundation on tips and tricks for submitting a qualitative abstract to the Free Communication Program. Today we'll cover the basic tenets of qualitative research, abstract submission elements, we'll go through an example, and then discuss some common reasons for rejection. My name is Melissa Snyder, and I'll be the facilitator for this session. I'm an associate professor and director of the undergraduate athletic training program at Western Carolina University. I'm in my fourth year on the Free Communication Committee, and I do a lot of qualitative research, mainly in the educational realm. So let's get started. There are various approaches and theories within qualitative research. A few examples are grounded theory, phenomenology, ethnography, case study, biography, critical theory, and social theory. Theories provide complex and comprehensive conceptual understanding of things that cannot be pinned down. For example, how societies work, how organizations operate, why people interact in certain ways. Theories give researchers different lenses through which to look at complicated problems and social issues. It helps focusing their attention on different aspects of data and provides a framework within which to conduct the analysis. Qualitative research is a descriptive and explanatory paradigm of investigation. It involves the observation and analysis of information in natural settings to explore phenomena. Also helps understand issues and answer questions. Qualitative research is data-driven versus hypothesis-driven, and it is based on methods of data generation that are flexible and sensitive to the social context. Within the qualitative research paradigm, qualitative methodologies are neither subjective nor objective. They are interpretive by nature. They are oriented toward the explanation of a social phenomenon. The methods allow for detailed description of data and an explanation of trends and patterns found during the investigation. There are various things that you will need to do when you upload your abstract submission. First, title should be brief, clearly describing the content of the abstract. The title should be entered in title case. Do not include a trial or any identifying information. Items 2 through 5 will be covered in the next slides. You also may upload a table or a figure in PDF form. Qualitative abstracts are limited to 600 words, not including headings. We are asking you to also identify the research agenda domain and the domain in the practice analysis. The learning objectives should follow the best practices for learning objective construction. Refer to the BOC's Developing Measurable Learning Objectives for more information. Please also include a key take-home message for possible use on social media that is 120 characters or less. It should be concise and could be used to promote the abstract on social media. Please also provide 1 to 2 key references or sources supporting the submission's content, format according to the Journal of Athletic Training author guidelines. You will also need to upload a CV or bio of the presenting author. Please indicate if there are any disclosures and funding sources. Indicate if any author has a relevant financial relationship with commercial interests that have the potential to affect the content of the abstract. Indicate the funding source and grant number if appropriate. If the authors have no disclosures, enter the authors report no relevant financial disclosures. Please review the policy for submission of the disclosure form and presenter commitment. This section does not count towards the word count. Please also indicate the skill level of the presentation, whether it is essential, mastery, or advanced. We're going to use this abstract as an example to talk about the different abstract components. Within the context, briefly explain the rationale for the study, provide a background for the study question, and state the precise objectives or questions addressed in the abstract. There are several things that need to be included in the methods. Let's look at the example for the components. Please describe the overall study design of the study that is reported. For example, critical theory or grounded theory. Describe the environment in which the study was conducted to help the readers understand the transferability of the findings, such as clinical setting or educational institution. Describe the underlying target population, selection procedures, and important aspects of the final subject pool, such as number, average age, measures of variance, years of experience, or gender. Describe the essential pieces of the sampling method, such as theoretical sampling and criterion sampling. Describe data collection tools, such as the interview guide and survey. Also talk about the development and type of validation. Please describe the data collection tool, such as an interview guide or survey development and type, and also the validation. Interview guide and development was not included in this example. Describe how the data were collected, such as interviews, observations, or document analysis. Describe how the data was managed. Example, interviews were recorded and transcribed verbatim. Identify if software was used. Describe how the data were analyzed. For example, the interviews were analyzed using an inductive content analysis or consensual qualitative approach. Include intercoder agreement information if relevant to the study. Identify any verification strategies used to ensure trustworthiness and credibility, such as indicate the form of triangulation or debriefing. In the results, you should include a short description of the findings, the interpretation of the data, and the theme consensus should be included. This should include identification and brief explanation of the emergent themes. Compile results so that it is meaningful and easily understood for the attendees. Summarize or emphasize the new and important findings of the study and relate implications of the findings for future research and for clinical practice. The statement of your findings must be consistent with the results as reported and should be no more than 5 sentences. You want to relate the implications of findings for practice, provide a take-home message, clinical bottom line, or recommendations that align with the objectives. The clinical take-home message may address one or more of the following aspects of patient care, such as financial implication, equipment needs, practicality of implementation, applicability of findings to various populations. Please make sure that this is relatable to how the attendees can use this information. There are several reasons why an abstract may be rejected, and these are the common ones. If you don't provide all the information that is requested, it may be rejected. Also may be rejected if there's poor overall clarity in writing, no theoretical framework, or methods are inconsistent with the theoretical framework. Also, if instrumentation is not well established, or the development or adaptation is not explained, or reliability and validity information is not provided, it may be rejected. Also, if the participants are not adequately described, there's no take-home message, or there is any identifying information. Thank you for listening, and please remember that abstract submission will occur September 15th to November 1st.